Hello, I'm Dr. Joshua Kibera, pathologist and founder of the Pathology Network. The Pathology Network is a health tech company in the lab diagnostic space. We're making advanced lab tests available to all African patients, regardless of their physical location. Did you know that if a patient is suffering from stage 3 or stage 4 cancer in Africa, it is less likely that they presented late for treatment and more likely that the diagnostic function of the healthcare system let them down? Most patients in this continent struggle to get a diagnosis of extrapulmonary tuberculosis or cancer. And this is because these diseases require an advanced lab test for diagnosis. And these tests are usually not available at that patient's local hospital. So the delays in the diagnosis tend to occur at this lab testing phase. And when there's delay in these kind of diseases, you end up having a very low chance of cure, especially for patients who are suffering from cancer. In Kenya, for example, the uncoordinated referral of tests from rural hospitals to centralized urban labs can cause significant diagnostic delays. It could take weeks or even months for a patient to get a diagnosis for their disease. And of course, they need this diagnosis to proceed to the next step, which is treatment. 95% of hospitals in Kenya do not have a resident pathologist or a pathology lab. The doctors in these hospitals perform procedures, surgical procedures, they draw blood, and then take these samples and send them to external labs and external pathologists. They rely on these external pathologists for a diagnosis, the diagnosis that will help them then proceed to treating their patients. The opaque lab test referral processes and the economic interests of various participating parties often leads to inefficient distribution of work amongst these external pathologists, and even leads to some delays in lab processes. This is tragic, especially because we don't have enough pathologists to begin with. All of this leads to poor diagnosis, poor quality diagnosis, or diagnostic delays, or both. Our company solves this problem by coordinating end-to-end the entire lab testing process through the use of specialized web-based software and mobile applications. We have developed an innovative workflow process that incorporates diagnostic process standardization, digital pathology, and logistical management to create overall efficiency. Our client hospitals order tests online. The doctors also order tests online, and they've tracked their tissue samples across the entire process on our web-based software or on their mobile app. And within 7 days, or 2 days in some cases, they get their results. They can then proceed to treat their patients because we in the background have ensured a stable lab diagnostic service. We have partnered with the network of laboratories as well as a pool of national and international pathologists. It's our job to ensure that there's efficient distribution of tissue samples across our network of partner labs and pathologists in a way that is safe and that ensures a consistent and guaranteed level of quality for our patients. We are excited about solving this problem, this lab diagnostic problem in East Africa, and we look forward to taking this homegrown solution to other parts of this continent as well. Thank you for listening.